Hello, Dr. Joe here. So, you know those annoying eye bags? You know, the bags you have underneath your eyes. And, they can be irritating, annoying. They make you feel really self conscious. And some of you folks have been in touch with me wondering what to do about them. And I felt the best approach would be to talk to somebody who deals with this kind of problem every day of their working lives. So I got in touch with an ophthalmologist, an IMD. His name is Michael Chua. He's based in California. And he was kind enough to lend me his time to talk a little bit about the measures that you can undertake to deal with eye bags. He was also kind enough to start off with, the least expensive measures, the at-home remedies, things that you can undertake at home that don't cost a lot. From then on, we progress to, the more permanent, measures that will cost a little bit of money. So before then, though, let's start with the at-home remedies that he recommends.
Yeah, there's a lot of different treatment options. I usually like to introduce them from safest and least expensive to
Yeah.
more invasive and more expensive. So I think a really good option for a lot of patients to try in the beginning is just thermotherapy, right? It's just cold compress, some sort of something cold, maybe a spoon, maybe an ice pack, maybe some frozen vegetables. You just apply it right to that under eye area for, I don't know, maybe 5 to 10 minutes, something like that. And what that does is one, it constricts the blood vessels in that area to help decrease the swelling. And if you've ever had, like at the grocery store, a really cold piece of meat or muscle, when it's really cold, it tightens up that muscle there. So that cold helps to tighten the muscle, the orbicularis muscle, that's kind of pushing that fat back. So that's a really good, safe intervention. It's basically free. Using a cold compress is a good first step.
Okay, so this is what Dr. Chua meant when he talked about the thermotherapy for dealing with eye bags. I'm going to do the demonstration for you folks right here, right now. It's about cold compression. Now, there are two techniques that I'm going to demonstrate for you now. Now, the first one is you take 2 spoons, you leave them in the refrigerator for a good number of minutes to make sure they get really cold. And then you bring the 2 spoons out because you got two eyes, so you need 2 spoons. Bring them out and then apply them to the affected area, the eye bags, okay, underneath your eyes. Now, that is technique number one, but I have another way of doing this very technique, and that's what I've got in front of me here. So, inside this very glass here, I got some ice cubes, and then I added some water as well. It's important you add some water, otherwise the cubes, the ice cubes will get stuck on the spoon. Now you dip the spoons inside this very glass, leave them in there to get really cold, and then you do this. I'm going to take off my glasses for this to demonstrate this. You take them out and then take out the spoons and apply them to the affected area, okay? Apply them to the affected area. How about that? Okay? That's it. That's all you need to do. Okay? So that is technique number one. So either you use the refrigerator or you use the glass of ice cubes to do it. So that's technique number one. Let's move on to technique number two, and that involves this here. This is an eye mask, okay? Eye mask. I need to take off my glasses again for this. This is an eye mask. You get one of these. They're not that expensive. And you leave them in the refrigerator. Leave this eye mask in the refrigerator for a good number of minutes for it to get really, really cold. It could be there for an hour or two. And then you bring it out, and then the next thing, you just apply it over your eyes. Make sure it's tight. It's got a Velcro at the back. Leave some room for you to be able to see what's in front of you. And that's it. Okay? Leave this here for a good number of minutes and you're done. Just like you would do with the spoons. That's it. Okay? So those are the two techniques that will help you to deal with eye bags using cold compression. So what about the eye creams? Do they work? And if so, how do they work? Let's hear what Michael Chua, MD, has to say about them.
There's a few different creams. They have varying effects. I would say the majority of creams don't really work that well. Um, First of all, a moisturizer is important. You can get, it doesn't have to be an expensive one that you get at a beauty store. It could be what we have here in the States, CeraVe. I think that's a good moisturizer. No financial interest, by the way. But just moisturizing the skin to help plump it up, like we were mentioning, that's a good option. They do have these kind of eye bag creams that kind of magically shrink your eye bags. A lot of them, they have these ingredients which are basically estrogens, which just temporarily constrict the tissue. And I mean, it actually is pretty effective, but it's a temporary effect. It's usually good for a few hours and then it wears off. Another, I guess, problem some people say with those estrogens or those kind of tightening creams is that sometimes they leave a white residue. And so it doesn't, maybe your eye bags look better, but you have kind of these white stains under your eyes. So it doesn't look that great either.
What's in them? What's the astringent? Is it sodium silicate or something like that? Or?
That's right. That's the most common one. There's a whole bunch of different manufacturers, but yeah, that's one of the more common ones, sodium silicate. That's right.
And now it's time for us to talk about the fillers. We're moving on a little bit to things that will cost you a little bit of money. The fillers, are they recommended at all in the medium to long term?
Another, I guess, moving up the different treatment options, one that we see here in the States at least is using fillers. So injecting fillers in the under eye area, and that helps to kind of round out the appearance of that under eye area. The problem with fillers, though, is that many injectors say that it kind of gets absorbed or dissolves after a few years. But when you look at the studies, when they do MRIs, they'll of people who've gotten fillers 10, 12 years ago, that filler is still there. And the problem with filler is that, let's say you inject it in the under eye area and you're really happy with how it looks the first month, 2 months, 6 months. If that filler is still there 10 years after the fact, you're not 100% positive it's going to stay exactly where you want it. And the other thing too with fillers is that it's hydrophilic, it attracts water. And so over the course of time, you can kind of have unpredictable results. And so you might be happy maybe the first few months, but that appearance can kind of change from the filler several years down the line. And the difficulty with the filler is, like we mentioned, it's kind of there for many years after the fact. And so it's hard to kind of remove the filler. You can use what's called hyaluronidase, which is an injection. It's like an enzyme that breaks down the filler. But it's a really tough shot. I mean, when you think about the eye anatomy, you really don't want to, at all costs, try to avoid sticking a needle anywhere near your eye. It's a blind shot. It's really hard. And so if you're trying to inject hyaluronidase, which is an enzyme that breaks down tissue, and you're injecting it anywhere near your eye, that's obviously a bad spot to be in. So I generally avoid I don't offer filler to patients as a treatment option for under eye bags, but it's something that some people do.
In the end, a lot of those things we've talked about are really temporary measures. They don't provide a permanent solution to the problem. So, what is the permanent solution to dealing with eye bags, or should I say, getting rid of eye bags permanently?
The I guess more permanent option that we offer to patients is we offer lower lid blepharoplasty. And so it kind of depends on everyone's anatomy and the prominence of their tear troughs. But one general approach we do is we go through transconjunctivally. So basically that pink tissue at the bottom of the eye here, that's a conjunctiva. We can make an incision inside. And so there's no scar, there's no outward incision that people see. And then you can just approach the periorbital fat that way, and you're able to remove some of that periorbital fat to decrease the appearance of the eye bags. And so, if you think about the different treatment options, they're all pretty temporary. And, the underlying cause of the eye bags is really just that periorbital fat coming forward. And so, if you're thinking about a permanent solution, the only way is to just get rid of that periorbital fat, which we do with surgery.
So there you have it. If you want a permanent solution, then you have to undertake blepharoplasty. Yes, it's going to cost you a bit of money, but the cosmetic benefits are permanent. And I think that's the selling point. Obviously, if you don't have any money, you can continue with the temporary measures for as long as possible until you are able to save up for the procedure. So, Dr. Michael Chua, I'll leave his details in the video description if you want to get in touch with him. If you got some value from this very video, hopefully you did. If you did, please give the video a thumbs up. Please like the video, and also please share this video with your friends, with your family, with your colleagues. Got any questions, any comments, leave them down below. I think that's about it for this very video. Until next time, well, this is Dr. Joe signing out.